Hey, Cumberland County, Renee here, your sexual health educator and the director at your local sexual health center. Did you know that sperm can live for up to 5 days in the reproductive system? Pregnancy doesn't happen right after you have sex. That's why it's possible to prevent pregnancy shortly afterwards. That's called emergency contraception. Emergency contraception comes in two main forms. One is an IUD, which needs to be inserted by a nurse practitioner or a doctor within 5 days of unprotected sex. They can be expensive without health insurance. The more common method of emergency contraception is known as the morning after pill, which can be taken at any time of day as long as it is within 72 hours of unprotected sex. Studies continue to show that the sooner that you take it, the more effective that it will be. So, how does emergency contraception work? Well, it works in two ways. One is by preventing ovulation or delaying the release of the egg through the fallopian tube, and the other is to prevent the sperm from getting to that egg. It is important to note that after implementation has occurred, emergency contraception is no longer effective, but there are other options available to you. Emergency contraception has been taken by millions of people over the last 3 decades, and it is pretty safe, but there are some important tips to remember. Number one, emergency contraception is not going to prevent sexually transmitted infections. We always recommend using dual methods, meaning that you use a condom or a DAM in addition to hormonal birth control. Taking a whole bunch of pills at once is going to make you sick. It is not going to be more effective. Always follow the instructions and the directions. Emergency contraception is not meant to be your regular form of birth control. If you find that you're missing pills, check out one of those apps that are available right now that can help to keep you on track. Remember to always talk to your healthcare provider if you have any questions, and we're also here to help. We hope that you find this information useful, and on behalf of all of us, have a safe and happy day.